You know, amongst all countries, America has the highest rate of reported STDs, with about 15 million new cases reported each year. African Americans make up for over 50% of these cases, though we only 12% of the population. You know, some people blame this on poor education, poor health care, and drug use. But reporting on many of these diseases can be very biased. In many areas, reporting from public sources like STD clinics is more complete than reporting from private sources. And since more minorities seem to use these public clinics more than whites do, the ratio between blacks and whites can be extremely exaggerated. Research has shown that people with these other STDs have a higher chance of contracting and spreading the AIDS virus. Now, a lot of African Americans believe that the AIDS epidemic was created by the government and targeted at black communities as a means of wiping them out. But the government would do something like that, right? But have you ever heard of the Tuskegee experiment? This was an experiment conducted by the U.S. Public Health Service between 1932 and 1972 on a group of poor, unsuspecting African Americans in Alabama. These people were fooled into believing they were receiving free health care, but were really injected with the syphilis virus so the government can study the effects the virus had on African Americans, spreading the disease throughout our community. Now, you know, chlamydia is the most common STD. It infects your urinary tracts and leaves it irritated and leaking. But don't get this confused with gonorrhea, which gives you a drip and a real bad burning sensation. Let's not even talk about HPV and herpes, which they haven't even developed a cure for yet. Now, you know it's also possible to have all these diseases and show no symptoms, but still spread them to a partner?
So what you want to do?